Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpal ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in. Heart 5 is on the flexor aspect of the forearm. It's 1 sun proximal to heart 7, on the radial side of this flexor carpal ulnaris. Pericardium 7 is on the flexor aspect of the wrist. It's level with heart 7 and between two tendons, palmaris longus and flexor carpal radialis. Some people don't have this palmaris longus tendon, in which case you'd just be going ulnar to this flexor carpal radialis. So finding heart 7, articulate the wrist, coming between those two tendons, that if you can't see them, you can get the person to join their thumb and their little finger together, and that will highlight those two tendons. And just relax again.
Liver 2 is located half a sun proximal from the edge of the web margin between the first and second toe. Spleen 4 is located in a depression which is distal and inferior to the flare of the base of the first metatarsal. Feel along the inferior border of the first metatarsal, find the flare of the base and place your point in between that flare and muscle. Spleen 4 is about 1 sun proximal to spleen 3. Be careful when palpating along the inferior border of the metatarsal that you don't overshoot the head and find this nice dip in between the medial cuneiform bone and the base of the metatarsal. It's a nice dip, but it's not spleen 4.
Ren 17 is on the anterior midline, level with the 4th intercostal space.